Copyright disclaimer. Under Title 17 U.S.C. Section 107, allowance is made for fair use for purposes such as criticism, comment, news reporting, teaching, scholarship, and research. Fair use is permitted by copyright statute that might otherwise be infringing. Nonprofit, educational, or personal use tips the balance in favor of fair use. Okay, this article is from Cleveland Clinic. Cleveland Clinic-led study discovers link between high levels of niacin, a common B vitamin, and heart disease. This is labeled February 19th, 2024. Excess niacin breakdown product fuels inflammation, cardiovascular disease through newly discovered pathway. Cleveland Clinic researchers have identified a new pathway that contributes to cardiovascular disease associated with high levels of niacin, a common B vitamin previously recommended to lower cholesterol. That's Stanley Hausen, MD and PhD. The team led by Stanley Hausen, MD, PhD, discovered a link between 4PY, a breakdown product from excess niacin, and heart disease. Higher circulating levels of 4PY were strongly associated with development of heart attack, stroke, and other adverse cardiac events in large-scale clinical studies. The researchers also showed in preclinical studies that 4PY directly triggers vascular inflammation, which damages blood vessels and can lead to arterial sclerosis over time. Scientologists, this one's for you. I want you to know what's going on. The study published in Nature Medicine also details genetic links between 4PY and vascular inflammation. The findings provide a foundation for potential new interventions and therapeutics to reduce or prevent that inflammation. What's exciting about these results is that this pathway appears to be previously unrecognized, yet significant contributor to the development of cardiovascular disease, said Dr. Hausen, Chair of Cardiovascular and Metabolic Sciences at Cleveland Clinic's Lerner Research Institute and co-section head of Preventative Cardiology in the Heart, Vascular and Thoracic Institute. What's more, we can measure it, meaning there is potential for diagnostic testing. These insights set the stage for developing new approaches to counteract the effects of this pathway. Niacin, vitamin B3, is very common in a Western diet. For decades, the United States and more than 50 nations have mandated niacin fortification in staple foods such as flour, cereals, and oats to prevent disease related to nutritional deficiency, said Dr. Hausen. Yet 1 in 4 subjects in the researchers' patients' cohorts appear to be getting too much and had high levels of 4PY, which appears to contribute to cardiovascular disease development. Dr. Hausen compares our intake of niacin as multiple taps pouring water into a bucket. Once that bucket is filled, it begins to spill over. The human body that needs to process that spillover and produce other metabolites, including 4PY. The main takeaway is not that we should cut out our entire intake of niacin. That's not a realistic approach, said Dr. Hausen. Given these findings, a discussion over whether a continued mandate of flour and cereal fortification with niacin in the U.S. could be warranted. Dr. Hazen notes broader use of over-the-counter supplements made with different forms of niacin have also become popular because of presumed anti-aging purposes. He adds that patients should consult with their doctors before taking over-the-counter supplements and focus on a diet rich in fruit and vegetables while avoiding excess carbohydrates. The new findings also might help explain why niacin is no longer a go-to treatment for lowering cholesterol. Niacin was one of the first treatments prescribed to lower LDL or bad cholesterol. However, eventually niacin showed to be less effective than other cholesterol-lowering drugs and was associated with other negative effects and higher mortality rates in previous research. Niacin's effects have always been somewhat of a paradox, Dr. Hazen said. Despite niacin lowering of cholesterol, the clinical benefits have always been less than anticipated based on the degree of LDL reduction. This led to the idea that excess niacin caused unclear adverse effects that partially counteracted the benefits of LDL lowering. We believe our findings help explain this paradox. This illustrates why investigating residual cardiovascular risk is so critical. We learn so much more than what we set out to find. The study authors note that long-term investigations are needed to assess the effect of chronic elevation of 4-PY levels of arterial sclerosis and other phenotypes. The research is part of Dr. Hazen's ongoing investigation into factors that contribute to residual cardiovascular risk. His team follows patients over time and collects blood samples to find chemical signatures that can predict the development of heart disease. He has made pioneering discoveries in arterial sclerosis and inflammatory disease research, including the seminal discovery linking gut microbial pathways to cardiovascular disease and metabolic diseases. Dr. Hazen also directs Cleveland Clinic's Center for Microbiome and Human Health and holds the Jan Bleeksma Chair in Vascular Cell Biology and Arterial Sclerosis. Mark Farrell, a former MD, PhD student of Dr. Hazen's, laboratory and student in Case Western Reserve University's Medical Scientist Training Program, is first author of the manuscript. Research reported on this publication was supported in part by the National Institutes of Health under award numbers. I'm not reading those, I'm not doing it. And then goes on to tell you about Cleveland Clinic. So that's just a little bit of information on if people have too much niacin. And I've heard this before, that when you have too high levels of niacin, that it damages your heart. And I'm not a doctor, I'm not a nurse, I'm not a medical professional, but that is what I've heard. So I do wonder if there's a way to detox all that additional niacin. And I know that there were studies done in Germany, the German doctors had done regarding the high levels of niacin in people, Scientologists that were taking. So anyways, not very great information, but you guys get the gist of what I was saying, and I will put the link in the description box. Peace.